World Health Organization guidelines on home-based care, which we adopted. As part of our strategy to combat COVID-19 virus, we had quite a number of skeptics who questioned the value of this program. But I'm sure by now, with the successes we have seen, we have been vindicated. In the last 1 week alone, a total of 2,738 patients placed under home care-based program have recovered from the disease. There are still many more who are currently placed under the program, and we want to wish them quick recovery. This is a major success in the fight against the disease, a disease that has ravaged our country and put the lives of many Kenyans at risk. Even as we continue to ramp up other measures to curtail the spread of the virus, the success of the home-based care program for those infected has given a whole new impetus in this fight. As our top medical personnel have continued to explain on the details of the home-based care program, we shall continue to emphasize to our people the need to embrace this program. This is because it is a far much cheaper and better option towards the recovery of a patient for all of those who are asymptomatic, as opposed to being admitted and held in a hospital facility. To begin with, as we have always indicated, about 90% of our COVID positive cases are asymptomatic, who can therefore be managed from home. This means that our facilities will have to care for the remaining 10% of COVID positive patients, those that will need hospitalization being those with moderate, severe, and critical disease. More importantly, the home-based care program will free up our health facilities to provide the usual care for all other patients with diseases other than COVID-19. When managed from home, the asymptomatic cases would have the better home environment, which psychologically enables them to recover faster and resume their normal lives. This gives the answer to the high number of recoveries from the COVID-19 since we launched this program about 2 months ago. It is also more cost-effective because it is cheaper, noting that 80% of the amount of money spent by a patient in a facility that cares for COVID-19 goes towards the purchase of personal protective equipment used by healthcare workers. So you can see that a large portion of the costs that go into care are actually costs that go towards protecting healthcare workers by providing them with these PPEs and other protective equipment that are quite costly. Ladies and gentlemen, in the past few weeks, we have seen a steady increase in the number of our positive cases. And this is something that worries all of us. Of particular concern, the rising numbers in our capital city and the county of Nairobi is a matter that we need to be very concerned about. While initially the coastal town of Mombasa was recording higher cases, but we have seen that since then the numbers out of Mombasa have begun to stabilize and maybe even begin to fall. This is good news, considering that the coastal town is among our major tourist destinations and the gateway to the East African region. Clearly, the measures in place there are working, and this needs to be encouraged. The coastal people must not let their guard down if their numbers are to continue to drop. And we want to thank the people of Mombasa for the strict observance of the containment measures that has seen their numbers stabilize and begin to fall. Nairobi, as I stated, and you know, over the last few days, a larger number of positive cases are coming from Nairobi. But apart from Nairobi, there is now focus shifting to counties neighboring the larger metropolitan area, namely Kiambu, Machakos, and Kajiado. Kiambu, for instance, has been recording a steady rise in infections. We are appealing to residents of these counties to strictly adhere to the containment measures for the spread of the virus to be under check.